Good morning and welcome, and thank you for joining us today on the Modified Family Services Resource Webinar as part of an ongoing series to support family support staff in ECAP and Head Start during the COVID-19 pandemic. Before we get started, we want to share a few tips to make this webinar a positive experience for everyone. At this time, everyone is muted except the facilitators. We're recording this webinar and we'll post it on the Basecamp by early next week. If you want to ask questions and share comments, please do so by typing them and sending them to us via the question box. We ask that you use the question box rather than the comment box so we can maintain a record of our conversation today. For those who do not know, let me explain how you use the question box. At the top right-hand corner of your computer screen, you should see a little rectangle that's either orange or red and it has a white arrow in it. Click this arrow to expand the control panel. Partway down the control panel, you should see a box where you can type in and send questions. We will answer questions as time allows throughout the webinar, and if we do not get to your questions, they'll be logged and responded to. And now, real quick, for a bit of question box practice, please type what you had for breakfast in the question box. We also want to remind everyone, we will not be answering any questions directly related to COVID-19. All COVID-19 questions should be sent to the dcyf.covid-19@dcyf.wa.gov inbox, and responses will be posted on the DCYF COVID-19 webpage. And wow, we have got breakfast coming in fast and furious, so it's working and people know what to do. Before we get started today, we want to introduce each person who is facilitating this webinar. So I'm Jess Robertson. My pronouns are they, them, their. I'm an ECAP Innovation and Quality Specialist in Vancouver, Washington. And I want to acknowledge that I'm presenting today from the traditional land of the Chinook, Cowlitz, Klickitat, and Clackamas people. And now I'll hand it over to Carrie to introduce herself.
Good morning, everybody. I'm Carrie Beamer. I use she, her pronouns, and I am coming to you live this morning from North Bend. But I would like to acknowledge that I'm presenting today on the traditional lands of the Snoqualmie people, people of the moon, and they have resided here in the Snoqualmie Valley since the rivers and mountains remember. I think I'm passing it off to Letty.
Good morning, everyone. My name is Leticia Cárdenas, and I didn't have breakfast. I am fasting today because I ate so much yesterday. Anyways, I'm Innovation and Capacity Specialist, and I want to acknowledge and honor. I am presenting today from Yakima Tribals here. They have a flag that has it reflects on the morning star that it means guidance and leadership. And I pass it on to Jen.
Thanks, Letty. Good morning, everyone. I'm Jen Anderson, and I use she, her pronouns, and I am a readiness and capacity specialist working primarily on expansion of ECAP throughout Washington State. And I am sitting here today in my home office in DuPont. And I would like to acknowledge that I am presenting from the traditional lands of the Nisqually and Coast Salish people. Welcome to the webinar.
Thanks everybody for introducing themselves, and looks like we got a lot of really great breakfasts. I see an apple oatmeal, which makes me smile because that's one of my favorites. A lot of toast, coffee, Captain Crunch, and just a variety. Oh, vanilla chai tea, that's another one. Eggs, and I could go on for hours, but we're here for other things. And so, Carrie, I'm going to switch the slide for you, and you can go ahead and jump in.
Great. So this morning we're going to talk to you about no particular order. There is an order, but we might jump around a little bit. We're going to talk about mental health for your families, for yourself. We're going to talk about boundaries, self-care. We're going to do a little bit about mindfulness, and then Jen's going to share some resources that the mental health community has really, I think, stepped up during this time and has been pretty innovative in thinking about how are they going to serve people's mental health needs during this pandemic. So, okay, we can go to the next slide. So I have a question for you all. And you can go ahead and click the question, and I just want you guys to chat or type in yes, no, maybe I've heard this. In your life as family support, have you been told or have you uttered the words, family support is not mental health therapy, right? I'm curious to see how many of you have heard that before. I see some yeses and I see some nos. Well, I know as somebody who supervised family support staff, we talked about it quite a bit in our teams, that it's pretty easy to sort of go down this road of where family support stops, and then it sort of bleeds into mental health therapy. And so today we just want to talk a little bit about boundaries and self-care, and a little bit about mental health services that are available for families that you're working with. And I did see, Jen, that there was a question about resources that we're sharing, whether they're adult-driven or for children specifically. So I don't know the answer to that, Jen, and I guess I think they're both. Is that correct?
Yeah, that is correct. And I'm going to give you some general resources and then also talk to you a little bit about how you can do more digging in your own communities. But I'm also going to post much more than what I'm going to share today on Basecamp next week. And they are indeed both for children and families and for yourselves if you feel like that's something that you need. So there's a variety of things that I'm going to be offering.
Great. Okay, Jess, if you want to go to the next slide, I just briefly want to talk about setting boundaries. And, you know, doing family support is really, really hard work, right? And we're asking you to sort of show up every day, being your best self and developing these relationships with families. But when we think about what we bring to the relationship that we have with our families, it's really important that we talk about boundaries. And that the reality of work and family support is that boundaries get crossed sometimes. It's I know it's happened to me in working in family support over the years. And, you know, sometimes it's just a human error. We're tired, we're stressed. It's a really difficult situation. It's a bad day. It's a pandemic, right? Sometimes boundaries get crossed. And, you know, we're asking family support right now to do more than they probably ever have for families. And I'm sure that it can at times feel really overwhelming. But, you know, during this time of social distancing, people feel disconnected. I've heard from folks that have emailed me, or I've talked to direct support service staff who say, you know, my families are really relying on me to be their connection. And, you know, it's still important to maintain that balance of that professional relationships. It just allows families to understand there's a clear role that you are in their life, and you know, that they sort of understand what the limits are to your role, right? And I know that that may seem a little blurry right now. None of us have ever lived in a time where we all were in quarantine in our house. So, you know, this is new for us. But there's some things I think may help you thinking about maintaining sort of those healthy boundaries is, you know, just sort of asking yourself, would you continue to do this? You know, would you continue to do this activity if things weren't the way that they were right now? And I know that many of you guys have talked about this in either professional development or with your supervisors about, you know, what is and what isn't allowable. I think a great example is where I used to work. We had an absolutely hard and fast rule. We didn't transport our families, did not ride in cars with us, right? So there's your organizational policies. And then I think it's just important to remember that cultural differences exist, and it's important to talk about boundaries with participants so that they understand what your role is. So I do have a question for you all, and I think that I'm going to start with just very, you don't have to type in a 2-paragraph statement or something, but why do you think it's important that we maintain our boundaries right now? So that's my question to you. Why are boundaries important right now?
Looks like they're coming in pretty fast, so I'm going to go ahead and read them as people are typing in.
Great.
So it looks like, now I got to scroll back up. Like I said, they're coming in really fast. This is a great reminder. I was stressing a lot in the first 2 weeks, and now I'm taking a new direction. And that was from Alejandra. Annie says we won't be there forever to help. Lorena says we can't provide services we aren't qualified to do. Yeah, very good point. Darcy says we can overwhelm an already stressful situation. Jamie says our own sanity. Fair enough. Colette says we cannot solve others' problems. Sarah says to keep a professional relationship, our safety, their safety. Yeah. Catherine says, where should I be typing this in? Exactly. I should probably read these before I read them out loud. Exactly where you typed it in, Catherine. Carmel says we want families to be able to accomplish self-dependence. Andrea says for stability for ourselves and our people. Ethna says we need to maintain our boundaries now for our own health as well and well-being, and for the well-being of our parents and families. Jessica says because we are already overwhelmed with our own workload. Ginny says because we hope this won't last forever. And there's a lot more, and for time's sake, I'm not going to go ahead and read through all of them, but I think there's a lot of the same idea. It looks if I just skim them really quick. So yeah, great response. Thanks, everybody.
Great. And if you think about when we were talking about mobility mentoring and being a coach, right? The coach is on the sideline. The coach has a guiding plan, but is not out on the field, right? They're not the ones doing the work. And I think that's another reminder about boundaries for yourself. Because you're right, it could put so much pressure on yourself and so much stress on yourself, especially during this time. So we really felt like we wanted to sort of start today talking about boundaries, but one of the things that we know that for you is that when we talk about boundaries, we can't talk about boundaries without talking about self-care and how you're doing your self-care now and what you're doing for yourself really lets you be that best person that shows up in that relationship with your families. So I'm going to turn this over to Letty, and she's going to talk to us a little bit about self-care.
That's right. We're going to talk about mindfulness today. And I want to let you know, mindfulness is a compelling life discipline that enables people to adopt an empowered mindset and active their ability to make decisions that are based on fact rather than emotions. Being in the now living moment by moment and seeing everything as fresh without judgment and worry. Let's experience life rather than simply get through it. Look around and live longer with a sense of adventure and curiosity. We can learn and experience more and more. Again, living moment by moment. I ask, just to everyone, why little things matter? My response is like, because it makes you feel alive. It makes you feel that moving from the autopilot to a meaningful life. Feelings are visitors, and you can let them come and go as they please. Allow yourself to feel. Talk to anger, sadness, and discomfort. Find a peaceful place where you can sit comfortably. Wrap up yourself in a warm blanket, light up a candle, look at the fire. That might relax you. Can we go to the next slide, please? And we're gonna reconnect to life here. I'm gonna ask yourself, are you getting enough sleep? Do you go to bed early? Do you wake up early? That really changed your day. Without sleep, your brain will not be able to function in a level to take care of all your problems that you have throughout the day. So getting about 7 to 9 hours of sleep will set your energy level to be dealing with your regular life or your new life or your new routine that you have. Take time for yourself. It can be exhausting being a home employee, teacher. Out of the sudden, you have all these roles all together. So make sure you're taking time for yourself. Nurture your relationships with your family. It's understandable that you are very stressed and sometimes you just paralyze yourself and sit down on the couch and start thinking, how am I going to do this? How am I going to do that? Make time for your loved ones to spend time with, to laugh, to tickle your kids, to just try to make yourself feel better. Let me see I kind of went away. Are you guys here yet? Yeah, eat healthy. Let's talk about eating healthy, because we're at home and we sometimes get bored and we tend to eat chips and maybe pop. Let's try to eat healthy. It will make you feel better, and it will also translate energy for you to continue and maintain a balance. With this word balance, can we move to the next slide, please? Thank you, Jess. This is a good time to master yourself, to self-love, to self-understand, self-exploration, self-awareness. In other words, get to know who you are. We hardly have these times to come down and understand what we want in life, what you are passionate about, what's important to you. It's about how we see life. So if you have this time to be at home for so many hours and be around your family, for me, it's a great time to think about your goals, really what you really want in life. It's to come down and see your surroundings, see what's reachable for you and what's in reality. Decide what's important. Make your choices, and that will help you balance your commitments in life. Prioritize and look for what's meaningful for you. Understand your mind and how efficiently it self-regulates. Self-regulation is the ability to keep disruptive emotions and impulses in check. So before you act, you think. It's one of the 5 elements of emotional intelligence: knowing your emotions, managing your emotions, regulation, motivating yourself, recognizing and understanding other people's emotions, managing your relationships. Being self-regulate means we're able to bounce back from negative feedback from something that puts you down. You gotta feel, this makes you feel less productive in life when you feel negative. If other people around us, which is our families, our kids, that you're spending time with in the quarantine right now, are able to see you, that you can bounce back in a positive way, that you are able to work and able to balance your life under pressure, they can trust you more with important work projects. They can know that you are a leader and you can approach these new changes in a positive way. You become, your strength will grow and you will feel better. And your reputation around others will make you feel like a self-worth in a way. These we also call as resilience. Just to stay positive and strong. Experiences make you who you are. And if you can balance your life and make it out of it, you'll be just a great leader. I don't know, what do we have on the next? I'm done with balance in your life. So, yeah, maybe Jen is going to talk to us about isolation well-being checklist, just making sure that we are doing the best that we can during this time.
Thanks, Letty. That was great information about self-care and finding balance in our life. And that's a really difficult thing for us to do, I think for all of us to do right now, given this pandemic and everything that's happening, that we've got our own personal life and craziness happening, and then we have our work life and what's happening with our families. And it can be very, very distressing and stressful and anxiety producing. And CC Parker had commented in the questions box, to be mindful is to be aware. And I wanted to bring that up because sometimes it's really hard to be aware of ourselves, self-awareness, and how well we are given all the stress when we're trying to take care of everyone else. So this isolation well-being checklist is kind of some guidance on helping us to be more self-aware in how it is that we're doing and what are some things that we can do to take care of ourselves to make sure that we're being able to get through day in, day out while we're not knowing when is this going to end. And I did include a copy of this document on your, I think it's a document upload. You'll see it in your little dashboard and you'll be able to click on it and download this if you're interested in doing that. But I just wanted to bring your attention that during this time of infectious disease outbreaks such as COVID-19, we can become much more emotionally distressed, and it creates more anxiety, and feeling anxious and confused and overwhelmed and sometimes powerless is common when something like this large crisis happens. And these feelings can occur even if you're not at high risk of being sick, but especially when you're working with people who are anxious and worried about what does this look like for our future. And fear and anxiety about disease can be overwhelming. And one of the things that we're going to talk about today is coping with stress, how coping with stress will help you and the people you care about and your community stronger. So given that, social distancing does not equate to social isolation, but sometimes it does feel like that, I think, certainly for me. So this checklist is kind of a guide to help you not feel so isolated. And it just helps go through what are you doing daily for your maintenance? Are you taking a shower? Are you remembering to take your medication? Sometimes our memories go when we're under duress and stress. Certainly it does for me. I feel like I have a lot of brain fog right now. So reminders to drink water. Maybe one thing you can be doing is cleaning one space at a time, one room at a time, to give yourself something to do that has some meaning, or to tend to something living or growing. If you don't have children at home, are you tending to your plants in the house? It gives you a sense of well-being and a sense of doing something. To be mindfully present is the same thing that Letty was talking a little bit about. Are you aware of a song or a sound that you're hearing? Have you been able to sit on your porch or deck and listen to the birds? What feelings are coming up for you? Kind of sensing that feeling. And is my body tense? Am I doing this all the time because I'm stressed? Or am I remembering to relax my shoulders and put my head back and just kind of take in some peace and calmness? And later, we're actually going to do a little mindful activity where we're going to do some breathing that will help, I think. Certainly it helps me bring me back to the moment when I'm feeling like my heart's really pounding and I'm getting really uptight about what I can or cannot do, and mostly what I cannot do right now. So some social connections, reach out to another human being outside of your home. Are you able to, wave to your, I'm looking out my window, by the way, if you're wondering what I'm looking at, wave to your neighbor across the street, or, yell a little hello. I saw something on social media the other day where a couple in New York, one person lived in one building and somebody lived in another building, but they saw each other from their rooftops, and ended up communicating, this is in the last month, with a drone. And now they're having this friendship that's developed in this relationship, and they even went for a walk, one of them in a bubble and the other one wearing a mask. And this reaching out in ways is creating human relationships like we've not had before in the past. So some really kind of cool things are happening if you can figure out other ways to socially connect. Say I love you to another human being. It's amazing what that will do to our hearts and our souls when we reach out in that way. And rest. I know that Letty mentioned, are you getting enough sleep? What are you doing to rest? Do one thing that gets your heart rate up, maybe some exercise, and also remembering to take a break, read a book, maybe watch something that makes you laugh, those kinds of things. And I am seeing some things in the checkbox that are asking, can we share this PowerPoint? We are definitely going to share the PowerPoint. And the checklist is absolutely something you can share with families, and I would encourage you to do so, both of those things. Oh, and it looks like folks were already answering questions, but I just jumped into as I saw them. Anyway, that's kind of it for the checklist. Let's go ahead and move to the next slide, Jess.
Jen, I'm wondering if if you pull your cord just a little bit closer to your mouth.
Am I hard to hear?
It was a little hard to hear. Not terrible, but
okay. Can you hear me better? No, a little bit. So I have my AirPods in, and I don't want it to be. I can hold this closer. I don't know if that helps. Is that better? Okay, I'll switch to the computer cord if that would be helpful. So let me know if, as I talk, if it's not
better,
good.
Jen. It's better now.
Okay, good, because I know how frustrating that can be not to hear the person who's talking, for sure. So I want to ask you folks a few questions and see, before we even go into the details of what we have for resources, what resources are being helpful for you right now, and where do you see gaps in those resources? Also, what would be helpful moving forward? I've heard from some folks that they were really feeling like, because there aren't actual places people can go for support right now, since so many things are closed, that maybe getting a list of what mental health services or behavioral health services are available through telehealth or telemedicine, which I am going to touch on later. But I did include a document that I had downloaded from one of the mini websites that I went down a rabbit hole trying to find these resources, but of the different programs, clinics, individuals for behavioral and mental health that are open throughout the state of Washington. I believe it's split up by county. It will let you know whether or not they're open, whether they're offering telehealth. It's really a great little resource, and that's something you can download and look at too. And I'm seeing some other comments where people are saying our local COVID response in Spokane has been a great place to find encouragement and resources. And thank you for that, Colette. I'll share with you as I go on to the state COVID response website, it does and can direct you to your individual counties. And that's where I think you guys are going to find the best resources, is from your individual county websites. Someone else commented, I think it's very important to acknowledge your feelings and emotions to be able to support from your family, friends, and community. Absolutely. That's, again, that self-awareness. And the more we can acknowledge how this is impacting us, I think the more, and have someone that we can share that with, the more we're going to be able to help families as well. Let's see. I'm looking to the questions right now. We are looking for support for families who have lower cognition challenges. Mary, I'm wondering if you want to expand a little bit on what you're referring to when you say cognition challenges, whether or not that's a language, or whether or not that's a reading, or if it's a access to a computer or a phone issue, or what the details that you're referring to about that is. so someone else asked about rental assistance resource because the Salvation Army in Vancouver does not offer rental assistance. And the Council for, I'm not reading, can't see all this, for homeless is out of funds. One thing I will let you know, there is an eviction moratorium right now. So if for some reason somebody's not able to pay their rent, they cannot be evicted for at least, I believe it's the 60 or 90 days. And this is on, and I'm going to show you in a few minutes, the coronavirus website for Washington State. It talks about the rental or eviction. So if for some reason you're not able to get them rental assistance, they cannot be evicted right now. No one can be evicted. And if somebody's trying to evict them, there is a resource to reach out to say, I need some help. They're trying to evict me. In fact, with that, I'm going to have you go ahead and forward, Jess, to our next slide, because there is a link that I'm going to want you to click on if we can. This is the specific link on Washington State's coronavirus page, and it is, I say, specific to mental and emotional well-being because that's what we're talking about today. But I'm going to go ahead and have you click on that link, Jess, so we can bring up that web page and I can show you guys a few things on there. And I think it's going to bring us directly to the mental and emotional well-being section for you and your family, because I think that's what I linked into the PowerPoint. Is it going slow, huh? Okay. So as you can see, the Washington State coronavirus web page has very specific information, and maybe some of you have already been able to check these things out. But I found this under the You and Your Family section. So what I'm going to have you do, Jess, I'm going to have you click back to the home. Do you see up there where it says You and Your Family and then it says Home? So this is what it looks like when you go to the home page for the Washington State coronavirus. And now if you go ahead and click on the You and Your Family now. And I'm just showing you guys so you'll know how to click through this one. And maybe some of you already have, maybe all of you already have, but if you haven't, it's super helpful. So You and Your Family, there are food and housing right there. That's a link that you can click on, as well as financial. I believe in the food and housing, it talks about or it might be under financial, the eviction moratorium. I'm not going to have us click on it right now. I'm going to let you guys explore this later. But you will get the details if you click on financial or food and housing, where you can find out where do I go if somebody's struggling with paying rent, and or if they just can't pay the rent and there's no help out there, what do I do to ensure that they're not going to be evicted? But now I'm going to have you click, Jess, on the mental health and well-being, since that's kind of what we're talking about right now. And this will bring us back to where we started on this page. And you can scroll down a little bit, Jess. I just wanted you folks to see how much information is in here. And I have this on another resource page I'm going to show you as well. But all of these give links to their website. There's 1-800 numbers. These are for you, for children and teens, for your families. There's some really incredible resources throughout here. And so I would just really encourage you to explore this page. They do a great job of updating it on a pretty regular basis. So it will, you'll probably be on there for hours. Certainly I was, hours and days, and that can be a little overwhelming at times. So I would encourage you as the staff person to be doing this before you offer anything to families, but you'll find downloadable worksheets you can give to families. You'll find specifics. How can I do, if I only have the ability to text, how can I get text support? If I only have a phone that doesn't allow me to access the internet, how can I do that? There's all of that information as you click through. So I just wanted you to be aware that this page is available, and it's just rich with information, help, and support. Okay, Jess, you can click out of that and we'll go on to the next. Oh, I'm going to have you real quick, Jess. Sorry, can you go back? I'm so sorry. I want you guys to see this virusanxiety.com website, because it's a pretty cool one that I found. And we can maybe put that in the chat box, and then people can click on it and save it so that they can later go to that. Or when we download this as a PDF, we'll have the link to that as well. But this is a really cool web page that I wanted you folks to be aware of, because it's got some really great information on it. So again, just some additional places for you to look for and get support. It doesn't it want to download there? There it is. Okay, so care for your coronavirus anxiety. This is your anxiety. This is your family's anxiety. This is children's anxiety, all sorts of things. And it allows you to share that toolkit, but you can see where there's all those different links. So for parents, there's a specific link. For financial fears, for anxiety, and in each one, there's meditations, free meditations. So these have some pretty amazing things. I listened to some of the meditations. They're super helpful when your heart rate is running high and you're feeling super anxious. So this is just another really great link that I wanted you to know was available out there and for you to explore at your leisure. So the website itself, it's www.virusanxiety.com. So virusanxiety.com. I don't know if it's in Spanish. I don't recall. I know a lot of the resources I found had Spanish available too. So we're scrolling down, looking to see. I don't know for sure. I'm not seeing a link that allows us to convert it to Spanish, but do a little exploration yourself and you might find more. Okay. All right, so let's go ahead and click on to the next. Are you still all hearing me okay? It's coming through. Okay, perfect. So I'm just going to start with some really basic mental health resources, and these are the 800 numbers that can get you some assistance right away. The Washington Mental Health Referral Service for Children and Teens. I told you that I would have resources both for children, but also for adults. That 833 number is a toll-free number. It's a referral service that directly connects patients and families with outpatient mental health services in your community. They can also help you with just quick, who do I turn to? Where else is there some information? Who can I talk to about this? This 1-800 on the right-hand side, it says 1-800-985-5990. You can request a text and to get someone to talk to you and or call. So that's through, I forget what the SAM HSA, it's something Mental Health Services Association. I can't remember the acronym, but it's another mental health program that is nationwide, but this is specific to our location, if I recall correctly. So that's the details on that. Those are very general. We'll go ahead and click to the next one. These are just reminders that if you know someone who's feeling really overwhelmed, or yourself with sadness, depression, anxiety, or they might hurt themselves, obviously first and foremost call 911. But there is the Disaster Distress Helpline. They are super helpful. The National Domestic Violence Helpline, there's been some understanding that there's an increase in domestic violence and sometimes child abuse during this stressful time because people don't have the tools that they need to be able to handle the additional stress that they're under when we know so many of our families are already under duress. And so these are great numbers to have at either a link or on your phone if needed. And our next one is going to give you some more national hotlines. And again, all of this is going to be available. We will have the PDF up on Basecamp by Monday. So national hotlines, there's SAMHSA's Disaster Distress Helpline. If you know someone's having mental health, they are open 24/7, 365 days a year. The National Suicide Prevention Lifeline, this one is great as well, 24/7, 365 days a year. I have utilized that before and they're super responsive. Then there's an additional 24-hour parent support. So sometimes parents are just feeling like they need support. They're not sure if they're going to be able to handle another day with their children in the home. Life is becoming overwhelming and I need another parent to talk to. It's another resource to be able to connect with where they can then connect you with local peer parents and or parenting programs and just be able to help you in the moment of distress that you're in right then. Okay, just go ahead and let's go to the next one.
Such a great information. Thank you, Jen. It's really, really great information.
Absolutely. And again, I don't want anyone to feel like they have to write this down quickly while they're up on the screen, because we are going to have it available to you. And that website that I showed you, those links are going to bring you to all these different resources as well. So sometimes if you can't reach, you know, I know that our phone systems have been somewhat locked up with so many people on them. And so, you know, if you can't reach one of the 800 numbers, try a different 800 number, but all of these are super helpful, and they are also confidential. Okay. And I want you to be aware too, for our substance use, and I'll talk about telemedicine in just a minute, but for our substance use, they have some really great connections for virtual AA meetings, virtual, oh goodness, I can't remember what it's called, well, there's Narcotics Anonymous. There's also for family members, and that's the one I can't think of what it's called right now, Codependence Anonymous or something like the Al-Anon. So some really great resources for that if you have families that need some connections in that way. I also understand that sponsors are working with folks who are already in recovery to ensure that they have connections on a regular basis via phone, text, virtual meetings, and so on. So there's lots of other connections besides the in-person meetings. Okay, now I'm ready to move on, Jeff. Thanks. So telemedicine, I think that sometimes it can feel really overwhelming and scary to think about doing something different than what we've done before. And technology is changing the way that we can access mental health services and all services, even just talking to a doctor. Digital tools are enhancing the ability to be able to receive treatment and delivery of services. So you can now meet with a psychiatrist, a psychologist, or a therapist in their office via virtual versus having to go to the office. So even though we're still in this social distancing or stay home, stay healthy state, it doesn't mean that you're unable to access this. Since the COVID-19 pandemic began, alternatives to traditional mental health treatment have become even more in demand. And I have utilized these services, and they're actually, even though it's weird initially, just like probably seeing us on screen and watching a conversation this way is a little strange, it's helpful and it works. And sometimes the screen may slow down. Sometimes you might lose someone for a moment, or as you guys noticed with me earlier, when you couldn't hear me very well, sometimes you can't hear very well. So it's not ideal, but it's absolutely doable, and it's a great alternative. So depending on what you're looking for, there's several digital tools on the market today that can help you reduce stress, anxiety, and depression, and improve your overall mental health and well-being. From that website I showed you on anxiety, there's those the meditations. There are actually calming apps. I think one of them is called calm.com, like CALM.com. And it sounded like I was saying calm.com, but anyway, there are different ways that you can work on doing some self-soothing, help families do some self-soothing, but also be able to reach out to your mental health provider through the telemedicine and possibly meet online. So I'm going to read to you a little bit about what telemedicine is. Telemedicine is the delivery of any type of medical service using technology. It's quickly becoming one of the most popular ways to get mental health treatment. It's similar to in-person visits, except that you meet with your mental health provider either through a phone call or a video chat. It might be on FaceTime or some other video. There are many video conferencing platforms that provide private and secure, as well as meet government standards for protecting your medical information. And so the provider will explain the HIPAA laws and how those different portals will ensure that it's completely confidential. Most insurance companies, including Medicaid and Medicare, cover telemedicine services. So I want you to be aware that it is covered through the different Medicaid services, but you can always call your insurance company to ensure that. Telemedicine has allowed many people to safely continue or begin mental health treatment during COVID-19. Seeing a provider right in your home rather than having to commute can be much more convenient too. So even after the pandemic's over, some people might find that this is preferable, especially if you live somewhere rural and you're not able to get into a community clinic on a regular basis. So telemedicine is especially helpful if you don't have access to transportation or childcare, or as I mentioned, live in a rural area where there's not enough providers. So there's lots of reasons and benefits to that telemedicine. So is there any other questions? What is the website? I'm not sure which website that was for. There is on the website that I showed you, the Washington State one, under your mental health and well-being, there's information about telemedicine. So you'll be able to click on that and get specifics. And then the sheet that I included in our downloads will have information about each of the clinics throughout Washington State that offer telemedicine, and they will help you connect. And I do want you to be aware there's a lot of different platforms. So right now, me personally, my daughter had to have an MRI because of a shoulder injury, and we had to see a clinician via telemedicine, and they had us download one app, whereas the therapist had us download a different app. So it might be a variety of different apps that you'll use, but they do explain really carefully about the HIPAA law and how it's can, kept confidential, and they do both of them that I've used have worked really well. So again, you might find that you'll get the specific website or app once you've connected with the provider. They'll let you know how to go about connecting with that. Okay, do we have any other questions that we want to talk about with telemedicine? If not, I think we'll move on to the mindful moment. Give it a few moments.
And, we didn't really talk about this, but I'm thinking maybe we want to give some space or some time too, either before or after we talk about a mindful moment, on subjects that you want to hear more about that we taught on this Friday check-in, or just leave some time for some general questions about modified services.
Absolutely, Carrie. Thank you for bringing that up. And I suggest that maybe we do it now, and so that we make sure that we get you as the field's feedback on what topics you want more of, if you want more details about specifics that we talked about today, if there's other things that you have questions on right now. Just give some space for that before we walk into this little mindful moment. And just so everyone knows, what we're thinking about doing is just a really brief kind of a breathing exercise that you can practice on your own to bring yourself into the moment, but you can also teach it to families and to children. It's just a really helpful way to help calm yourself when you're feeling overwhelmed, when you feel like your lid is slipping, when there's just too much coming at you and you can't take another thing and you need to take a breath.
Looks like we have one question that came in that says, does Medicare, Medicaid always cover telemedicine or just COVID-19? And I'm not 100% sure of every answer I think that could fall under that question. I do think as we're in the pandemic and we've got the stay home orders, if you're making appointments with your doctor that might typically go into the office that would be covered by Medicare and Medicaid, it would probably be a similar situation. And it isn't. And if the question is asking, is it just for like if you're sick with COVID-19 or something like that, then I think you would get advice from your medical professional as they have checked in with you, or you've gone into an emergency room or something like that. If it's other types of medicine that don't involve COVID-19, again, I believe it would be similar to the situation that I already mentioned. I don't know if Carrie or Letty or Jenny have anything else to add or have any more information on that. Probably what's best is to check in with your provider and your insurance to get that super clarified.
That's what I would suggest, Jess. And I had actually originally put a slide in the PowerPoint that led us to the Medicaid web page, but I took it out because I wasn't sure that we would have time on that. But I would encourage you to check out that web page because it does talk about those kinds of things and what's covered and not covered. And I know absolutely for sure things are covered no matter what because of COVID-19. Will things continue after? I'm not sure, but I am thinking that one of what's happening is people are seeing how helpful some stuff is that we didn't use before that we're using now because we've been forced to due to the pandemic, and that may change the future of how things look. But I don't know. I mean, that's just me predicting the future, and I really can't do that. So I would definitely encourage you to go to your provider, go to your the Medicaid webpage and check it out and see what it says on there. And we can do that too. I'll do a little more research and see if I can't find a better answer to get back to you as well.
So does anybody have, just go ahead and go crazy in the question box, any thoughts about resources that you are feeling like you need a little more support on? We already had one person sort of talk about the lack of resources for people with rental assistance. That could possibly be something that we cover, but we're really wanting to hear from you about the ways we can make this Friday check-in be really, really useful for you. So you can just go crazy writing your ideas in the box.
Carrie, can I also offer, if they can't think on the moment, because I know sometimes when I'm being asked right in the moment, I'm like, oh my gosh, I used to think I had this brain full of information that was helpful. If they can't think of it, can they put it somewhere on Basecamp as well over the next couple of days or weeks, and we can make sure we address that?
Absolutely.
I had it on my notes as a reminder. Please go into the Basecamp. It's there for you to comment, respond to another comment, just share an idea that happened to you, or in a story, anything that you have to share with others, you can share it there too. And you can just get to know each other there, and just kind of like a Facebook page for us. And we want to know what's happening out there. So please get in and there. Share whatever you need to share there.
It looks like we do have now some things that came in real quick. Yeah, I don't know if you're going to read the same one that I did, Jen, but resources for undocumented families. Yeah, absolutely, because some of the resources that folks are getting are not available for undocumented families. So absolutely, that's something we can look into. What were you going to say, Jen?
Now I'm trying to find the one that I was looking at, but I wanted to comment on it. It was, I think, a question about staff, or a comment that staff are feeling a little defeated right now, because, and I'm not seeing it, I can't find it, but it said something to the effect of staff are feeling. Okay, do you want to read it real quick, and then I have a comment?
Yeah, so Amber said, I know staff are feeling a little defeated by some parents' lack of involvement now, acting annoyed by the weekly check-ins, and would like to support in ways to encourage more meaningful conversations with those families that are more reserved.
So I am going to suggest, Amber and anyone else who's feeling this, if you're not already on the WASA weekly family support check-in meet, I think it's called a meetup, and it is on Fridays, and I believe it's at noon. I'd have to double check with my calendar, but I would really encourage you to participate in those, because that's a conversation. So that's a Zoom meeting, and there's ongoing conversations with other family support, and parents actually can be on that call throughout the state of Washington, where they're talking about these exact things and getting ideas from other folks. Like, what are you doing that's working? What's not working? How do we deal with that? And just trying to get really creative and think out of the box. It's a super helpful platform to have these interactions where you're having conversations with other folks who are either feeling the same way you are, or maybe have found a way to kind of fix that issue. So if you're not already doing that, I would encourage you to participate in that. And just recognizing that some folks, I would suspect, at least when I was a family support, I had some families who acted annoyed at me even when we weren't in a pandemic and I was checking on them, and some folks who were just super excited to hear from me every time I contacted them. So I think it's those are really normal feelings and experiences to be having, both now and in everyday life. Does anyone else have something they want to? So I think because we're getting close to our time, I'm going to quickly take us through this mindful moment, just so we have a few minutes to take care of ourselves for a minute, us on the call. And I just want to remind you, as days of isolation turn into weeks, months, many of us are feeling increasingly uprooted from our normal lives. So this is not normal. In a world on lockdown, it isn't just our routines that are being disrupted, but our relationships are too. And thankfully, distance doesn't have to mean disconnection. These challenging times remind us that it's never enough to just look after ourselves. We must look after each other too. And that's what it means to be calm together. And that's what I'm kind of hoping we might experience with this next slide. And we're going to try something, and I'm going to really hope it works, because if it doesn't, then I have to talk. And I'm hoping that the little video that I put into this next screen will do it for us. I'm not going to have Jeff click on it quite yet, but I want to talk to you a little bit about square breathing. So square breathing is a simple and powerful technique for balancing and calming the mind, as well as oxygenating the body and improving your respiratory muscles. So it actually brings in more oxygen into our body, which helps our brains think better. It helps our hearts. It helps every part of our body. This particular technique, which is the square breathing, is a technique that's used by Marines, as a matter of fact, to stay calm and concentrated in the most stressful of conditions. So kind of imagine, bullets flying over your head. They use this to get themselves back to that calm place. Hopefully, you will never be subjected to that amount of stress, but square breathing works perfectly in situations like we are in, which is a lot of stress right now, and it probably does feel like bullets are running over our head. It only takes a few seconds how to figure it out. It's about 1 minute of practice, and you're going to see that you'll feel more relaxed and focused again. So I'm going to suggest that we press play and see if we can hear it. If we cannot, I am going to lead us through the video, and we're going to watch as this little fish that has the arrow is going to be moving throughout the square. And during his movement, we are going to be breathing in, holding for 4 seconds, and breathing out and holding. So before we start, I'm just going to say, if it's possible, get real comfortable on your seat, preferably if you have a back to support you with both feet flat on the floor. It's really nice to feel that support of your chair and kind of the earth beneath your feet to just feel really supported. So just kind of take a moment to get comfortable in your position. And while we're relaxing, we're going to push play and see what happens. And if for some reason nothing happens, I will do it for us. So I'm very sad because it does not look like or sound like anything is happening. Can you push the play button again, Jess, just one more time to see if we can't get the fish to at least move with us? I don't know if it'll work. It looks like there's some other fun little things here too. So if you push the arrow, will that do anything? Okay, they're starting to swim. So what I want you to do is begin by slowly exhaling all of the air out of your lungs by a count of 4. So I'm going to say, let's go ahead and start now. 1, 2, oh, he's telling us to breathe in. Now we're going to hold it for 4 seconds and breathe out for 4. Now hold for 4. That's a fast moving fish. And we're going to breathe in as our fish goes up the square for 4 seconds. 1, 2, 3, 4, and hold. Now breathe out for 4. It appears as though our fish has disappeared. I want you to breathe out. 2, 3, 4, and hold. 2, 3, 4, and breathe in. And hold. 2, 3, 4, and breathe out. And hold. 2, 3, 4. And now I'm going to bring us back to just breathing normal because it's 11 o'clock. It's the end of our time. But I also want to and hope that you were able to get a little bit of that experience of how just mindful breathing can kind of bring you back into the moment, relax your mind and your heart, and help you to just feel a little bit more oxygenated and happy. So last slide, I think, is our thank you so much for coming slide. Does anyone have anything else that they want to offer or suggest before we say goodbye for this Friday afternoon?
Thank you so much for the briefing.
I will. Sorry, go ahead, Letty.
Thank you so much. I kind of got dizzy on my breathing, but yeah, it was good.
So the first time, Letty, that I did that, I got dizzy too. And so be careful as you're doing that. You may only want to do 2 seconds, breathe in, breathe out, and holds. You kind of want to play with it because you don't want to get dizzy and pass out for sure. And when you do get this PDF, it should have the link to that website, that YouTube website. So for all of you in the field, if you want to try it out, there's a lot of fun, different meditations for children on that particular link. So you'll be able to see some other things that you can either do for yourself, for your own children, offer to families and to their children as well. Thank you so much for coming, everyone. We're so glad to have you participating in this family support meetup on Fridays, and we look forward to seeing you next week.
Keep those ideas
Thank you,
rolling
everyone.
in. Post on
Yeah,
Facebook.
absolutely.
Bye.
Thank
Bye,
you, everybody.
everyone.
And
Bye,
for
everybody.
those questions that we didn't get to, we'll take a look at them afterwards and then put some responses on Basecamp. Have a great day.
Bye-bye.